Let's go straight to the specific viruses. The respiratory syncytial virus is the most common and the most important cause of lower respiratory tract illness in infants and young children, especially in those younger than 1 year old. About 70% of infants are infected by age 1 and almost all at age 2. Okay? Serious disease in the form of bronchiolitis or pneumonia becomes more likely if the infection happens between 6 weeks and 6 months old. Okay? RSV is spread by large droplets and by direct contact. The main portals of entry are the nose and the eyes. The incubation period is about 3 to 5 days, and viral shedding may persist for up to 3 weeks from infants and children, although adults are contagious for only 1 to 2 days. RSV replication occurs initially in the epithelial cells of the nasopharynx, but it may spread to the lower tracts and cause bronchiolitis and pneumonia. Okay? The spectrum of disease ranges from asymptomatic infection, so it can be asymptomatic, to the less serious common cold syndrome, to the more serious bronchiolitis and pneumonia. But the bronchiolitis is the distinct clinical syndrome associated with RSV. Usually, pag RSV gani, it usually presents with bronchiolitis. An important pathology in these infections is the formation of syncytia. Remember, di ba, during maturation of new viral components after replication, glycoproteins bud on the host cell membrane, right? This time lang in the paramyxoviruses, you will see the fusion protein spikes. Okay, so these fusion protein spikes or F protein spikes become activated even though they are not on the virions yet. Okay, so just following their function, they cause the host cell membranes to fuse with the adjacent cells, right? So forming one large synced cell called syncytium. Okay, and of course when daghan sila, plural syncytia. And while other cells form syncytia, other cells are also destroyed due to the virus hijacking their systems. Of course, this attracts promotion of inflammation, causing swelling and increased mucus production. This is particularly dangerous in children, no, whose airways are already narrower in the first place, so resulting in respiratory distress in patients. The complications can include air trapping and atelectasis or lung collapse due to the obstruction of the lower airways. And of course, decreased oxygen intake will lead to hypoxemia or decreased oxygen levels in the blood, which is especially vital in a growing baby. Although this picture is a picture of serious disease, most children resolve and recover, especially with the availability of modern pediatric intensive care na. No? Mortality rate is 1% or less even. Mortality rate actually becomes higher if the patient has pre-existing disease, like for example, congenital heart disease, because the body is not able to compensate for the complications. Treatment is actually mainly supportive, no? Removal of secretions or suction to prevent airway obstruction and to allow good ventilation, and oxygen supplementation. Okay, aerosolized ribavirin has also been approved for the treatment of lower tract disease caused by RSV. RSV antibodies in immune globulin is also helpful daw. But vaccines are difficult to make, mainly because of the target group ng infants. So as of now, vaccines are still being developed.